Anatomical terminology is a language that enables us to explain where things are on the body in relation to each other. Whenever the terms are used, they always apply to the body as if it was standing in the anatomical position, that is, standing upright, facing forwards, the arms hanging at the side, palms facing forwards, the legs together and the feet facing forwards. Any movement towards the front of the body or the front of the body is referred to as anterior or ventral. Any movement towards the back of the body or the back surface of the body is referred to as posterior or dorsal. Any movement upwards from the ground is described as being superior. Any movement down towards the ground is described as inferior. Any movement towards the midline is referred to as being medial. Any movement away from the midline is referred to as being lateral. When we describe landmarks on the arm and hand, we can refer to them as being either medial or lateral, but as the arm rotates, this can become confusing. So we often refer to things as being ulnar, as being towards the side of the ulna, or radial, towards the side of the radius. Any movement on the limbs towards the heart is referred to as being proximal. Any movement away from the heart is referred to as being distal. This also applies to the legs. So any movement up towards the heart is referred to as being proximal, and any movement down away from the heart is referred to as being distal. The outside of the body, or any movement towards the outside of the body, is described as being external or superficial. Any movement into the body or the inside part of the body is referred to as being deep or interior. Three planes can be useful in explaining how things lie in relation to each other. The sagittal plane bisects the body, separating the left from the right. The coronal plane dissects the body, separating the posterior from the anterior. The horizontal plane dissects the body, separating things from the superior and inferior aspects. Any rotation of the limbs towards the centre line is referred to as medial rotation. Any rotation of the limbs away from the centre line is referred to as lateral rotation. This applies equally to the feet. So we have lateral rotation of the foot and medial rotation of the foot. The leg and foot can make quite complex movements, and these all have different names. So as the leg moves away from the anterior midline, we have abduction. As it moves back to the midline, we have adduction. If I turn the model round, as we bring the leg up and we make the angle of the joint between the ilium and the femur less, we have flexion. So this is flexing the hip. If we make the joint between the femur and the bones of the lower leg less, then we are flexing the knee. So flexing the hip and flexing the knee. If we make the angle of a joint larger, then we are extending that joint. So if we extend the leg, actually we're bringing it back like this. Extending the hip is bringing the leg back like this. Extending the leg is bringing the leg back like this, extending the knee. Any movement of the limbs away from the centre line is referred to as abduction. Any movement towards the centre line is referred to as adduction. This refers equally to the legs. If the legs move away from the centre line, that's abduction. back towards the centre line is adduction. The term flexion is referred to reducing the angle between various joints. The term extension is referred to increasing the angle between various joints. This also applies to the leg. The leg flexes as it moves up and extends as the heel goes back. The hand can perform various movements. We can have flexion and extension, ulnar deviation, radial deviation, pronation, and supination. The thumb can move in several different directions, and you need to be clear in your understanding of how to explain each of these movements. If the thumb moves away from the palm, that is called abduction. This is extension of the thumb. This is adduction of the thumb. If the thumb runs over the palmar surface, this is called flexion. As the thumb moves to meet the little finger, this is called opposition. Bring it back is called reposition. The foot and ankle can make a series of complex movements, and these all have separate names. We have dorsiflexion as the foot comes up, plantarflexion as the foot goes down. When the foot turns in, that's called inversion, and as it turns out, that's called eversion.